guys, and welcome back to my channel. Today I wanted to go over specific scenarios so that y'all can implement patient assessment method or acronyms that I went over in my last video. We're gonna go over, I haven't yet decided how many, but we're gonna go over medical scenarios and we're gonna go over trauma scenarios, and we're just gonna go through them one by one, and I'm gonna show y'all basically how I studied for my patient assessment skills day and oral boards. Let's get started. I found some awesome medical and trauma assessments online, and I can put the links to both in my description because it was kind of hard to come up with scenarios on my own. So I, looked online for any scenarios so that I can practice and get a good feeling of what I need to improve, what I need to work on. Do I actually know the patient assessment? Like, have I memorized it enough to be able to be successful? So we're gonna start with the first one, and I'm kind of just gonna go along with the screen. Let's do a cardiovascular scenario. Okay, so we're gonna go over the first one, which is a cardiovascular emergency. And obviously beforehand, I have everything already written out. My BSI, SNAC, GLC, ABC, transport yes or no, OPQ or ST, sample, vital signs, field impression, intervention, reassessment, and oral report. So this is going to be a medical assessment. So whenever you're doing your skills day, they're going to say you are called to a hotel room for a 74-year-old male who is complaining of chest pain. So that's like your first clue, chest pain. Got it. And I usually write down the age and the gender above my notes. And then I say BSI, which just means that my instructor knows that I have the proper PPE on. So as I go, is the scene safe? And then nature of illness, according to the dispatch that I was given, it's a cardiac event or it's cardiac problems. And then I ask number of patients, 1. And then I would say, at this time, I am going to consider ALS, or I am going to consider additional assistance, but I will not consider C-spine. Then I move on to my general impression of the patient. This is something the instructor is going to give me. It gives me, obviously, a little bit more clues as to what the patient looks like, what they're doing. So this says a 74-year-old is sitting on the side of the bed holding his chest. So clearly he's having some chest pain. Then I say I'm going to check for his level of consciousness, and I'm going to say, hi, my name is Jessica and I'm an EMT. Can you tell me what your name is? And they respond, and I say, can you tell me where you are, what time it is, or what day it is, and then can you tell me why we're here today? And that's where I get their chief complaint. They say I'm having chest pains. So that's where that comes in. And so A&O times 4 just means that they were able to respond to all 4 questions that I asked them for the level of consciousness. Chief complaint, it says, is the worst pain he has ever felt in his chest. And I have to ask the right questions to be able to extract the right information. So this is how it's going to be with your instructor. Okay, I'm going to check for airway. I was able to assess his airway whenever I was assessing his level of consciousness because I had a conversation with him, and then you ask, is his airway patent or obstructed? And so they say his airway is open. And then I say, okay, I'm going to move on to breathing, and I'm going to get his respiratory rate. And usually they ask you how you're going to do that. And you say, I'm going to take the blood pressure cuff and I'm going to put it, actually, never mind. Respiratory rate, you're just going to say that I'm going to check their breathing every time that they take a breath for a minute. And then you ask, can I please get the respiratory rate? And they'll say 20. But then, very important, guys, you need to ask for the quality and the rhythm. You already got the rate, which would be 20. What is the rhythm? Is it regular or irregular? Please don't forget to ask. It is so important. You can say, what is the pulse? What is the respiratory rate? All they're going to do is give you a number. Now that gives you some clue as to what's wrong with them, but 56, okay, cool. Is it regular? Is it irregular? Is it bounding? Is it strong? Is it weak? Is it 30? You need to know these things. So please, please, please don't forget to ask whenever you're doing your patient assessment or your oral boards. I remember I finished my oral boards. That'll be another video. And she was like, great job. You asked for the quality and the rhythm every single time. A lot of students forget to ask. So respiratory rate, what is it, 20? Can you please give me the quality and the rhythm of this rate? For this case, they don't really give you a number, so that's why these online scenarios are kind of iffy. This one just says tachypneic, which is just they're breathing fast, which would be over 20 breaths per minute. And then you're gonna ask, are they getting adequate ventilations? But this patient is breathing fast. For this scenario, I would say, at this time, I'm gonna give my patient high flow oxygen at a rate of 15 liters per minute via non-rebreather. Boom, they have that checked off their list. Then I say I'm gonna move on to circulation. Is there any bleeding that I need to be aware of? Yes, no. Then I'm going to check the pulse of my patient, and I will do this by putting my fingers on their radial pulse and counting it for a minute. Ask for the pulse, and they say 50, and you get, great, what is the quality and the rhythm of this pulse? And then they tell you. And then you're gonna move on to, I'm gonna check their skin. I'm gonna assess their skin condition, temperature, and color, and you would say how you would do that. And then they tell you, okay, this patient is cool, pale, and diaphoretic. For the most part, that's what they're gonna say. And then you're going to say, it appears that my patient is experiencing signs and symptoms or signs of shock or exhibiting symptoms of shock. There we go. And I'm going to go ahead and put a blanket on my patient to keep them warm, and I've already administered them oxygen to help with the shock. Then you are going to identify if this is a priority patient and if you're going to transport them, and you're going to say, yes, I'm going to transport them, this is a priority patient. Then you're going to move on to OPQ-ST. And you're gonna say, I'm gonna be asking my patient some questions about his pain. Can you tell me what you were doing when this started? Can you tell me if anything makes it better or worse? Can you describe the pain to me? Does it stay in one place? Does it move? You do the scale of 1 to 10. When did it start? So onset, they give you everything. You just have to ask these questions. What were you doing when the pain started? Sleeping and woke up with chest pains. Does anything make it better or worse? No, nothing. Can you describe to me what the pain is like? And they say that an elephant is sitting on my chest. So you know that this is some kind of like a heavy pressure, crushing kind of pain in his chest. Does it radiate anywhere, or does it stay in one place? He says it goes into his jaw and his right arm. And then you do the scale, 10 out of 10, especially if you ask, 10 being the worst pain of your life, you know that this is a big deal for this patient. And then, how long ago did it start? 3 hours, and then I ask, or not that I ask, but I also write down and remember, how this ever happened to you before. And then you have your sample. Are you allergic to anything? No. Are you taking any medications? No. Is there anything in your pertinent past history that I need to know about? Nothing. So you know that this patient doesn't have any kind of cardiac history. So this might be a myocardial infarction. This might be a first-time heart attack. When's the last time that you ate or drank something? 4 hours ago. And again, what were you doing before this pain started? He was sleeping. Then you're going to move on to your secondary assessment. Now, like I said in my last video, whenever you're doing a secondary assessment for medical assessment, it's going to be specific to the area that is concerned about. So this would be the chest. And you're going to auscultate the chest. You're going to check for capillary refill and for pedal edema. So, palpate the chest, find nothing. I'm going to auscultate the chest. The lungs are clear and there's bilateral rise and fall of the chest. Check for pedal edema. There is no foot swelling. For the most part, this is kind of showing me in the direction of an MI. Then you gotta get the vitals. You're gonna say, can I get the blood pressure, please? And they're gonna say, how do you get the blood pressure? And you say, now you put the blood pressure on their arm and you use your stethoscope to figure out their blood pressure, but most of the time it's just a machine. Can I get the pulse? Again, quality and rhythm. Can I get the respiratory rate? And then you ask for, if you think it's a diabetic emergency, you would ask for blood sugar at this time. If you think it's a neurological emergency, you would ask for Pearl. So are the pupils equal and reactive to light? And then you get their oxygen saturation, which at this case is 95% on a non-rebreather. Then the field depression. So I believe that this patient is having a heart attack. Now this is just information for you to know how to treat your patient. You don't, in your oral report, say, I believe this patient is having a heart attack, because that's not your job. Your job isn't to diagnose the patient. It's for you to ask all of these questions to get an idea of what they might have to be able to give the right intervention before they get to the hospital. It says that the patient is possibly having a heart attack. And so you've already given them oxygen. Now, normally, because of the pain, you would give the patient nitro. But one of the contraindications of nitro is that if their blood pressure, their systolic blood pressure is under 100, you're not supposed to give any more nitro or not give any at all. And this is where you have to pay attention, because their blood pressure is 90/60. In this case, I would also give them aspirin, 162 to 324 milligrams, but it says here, do not give nitro due to blood pressure, and remove any loose fitting clothes and place the patient in shock position. Usually, you would give them nitro and you would wait 5 minutes and then you would reassess the patient. In this case, they haven't given them anything, but you do want to reassess your patient every 5 minutes because they are unstable. Your reassessment would be these new set of vitals. So 96 over 62, 62, Now, I know this doesn't give you the quality and the rhythm of either the respiratory rate or the pulse, but you still need to ask. Just because this scenario on the internet doesn't have it, doesn't mean that you don't have to ask. So, pulse, respiratory rate, oxygen saturation, and then you have your oral report, which I would say we are en route with a 74-year-old male who presented with chest pain. I would give his pertinent past history medications, or if he's allergic to anything, which he isn't. I would say his last known vitals were 96/62, pulse was 62, blah, blah, blah. Respiration was 16, oh my goodness. 16, regular, and labored. And you would give his treatment, so in this case, oxygen, and maybe aspirin, but they obviously know that you didn't give them nitro. So very short, concise, give them like exactly what they need, because they will be asking all of these questions that you just asked the patient once they get there. So at this point, you have successfully done your patient assessment or your oral boards. Okay, so that was a cardiovascular scenario. Okay, next you're going to do, let's do number 3, respiratory emergency. You would again write down all of your things, your BSI, SNAC, GLC, ABC, blah, 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 blah. And then whenever you're ready, you say, go ahead, I'm ready. And then they say, you are called to a high school in the band hall for a 15-year-old female with a possible asthma attack. Then you go through your assessment. I would say, BSI, is the scene safe? Yes. What is the nature of illness? Respiratory distress. What is the number of patients? 1. At this point, I am going to request additional resources or an ALS truck, but I will not be considering C-spine. General impression of the patient, 15-year-old female sitting on the ground having difficulty breathing and anxious. I'm going to move on to level of consciousness and say, hi, my name is Jessica. I am an EMT. Can you tell me your name? Can you tell me where you are? Can you tell me what day it is? And do you know why we're here? So they're A&O times 4. Can you tell me why you're here? What hurts the most? What is your chief complaint? Which is difficulty breathing. Then I would move on to their airway. I would say, I assess their airway by asking them questions. Is it patent or obstructed? And they would say open but audible wheezing. So that gives me a clue as to what could be wrong, which is it might lean more towards this asthma attack. I'm going to move on to breathing. Can I get the respiratory rate? And they will tell you. And then can I get the quality of the rhythm? And they will tell you. Tachypneic with shallow, or which is shallow with wheezing on exhalation. Are they getting adequate ventilations? Symmetrical rise and fall of the chest? Yes, but I'm gonna go ahead and put them on high flow oxygen at 15 liters per minute via non-rebreather mask. Then I'm gonna move on to circulation. Is there any bleeding that I need to be made aware of? No. Can I get the pulse of this patient? 60. What is the quality and the rhythm of this pulse? It is strong and regular. Great. And then I'm going to assess the skin condition, color, and temperature. This patient is cool, pale, and diaphoretic. I mean, I don't know why she'd be going through shock, but I'm gonna put a blanket on this patient and she already has oxygen. Then I'm going to, this is a high priority patient, I'm gonna go ahead and transport. Then OPQ or ST. What were you doing when your respiratory distress started? Now, this can be used for different things. OPQ or ST can be used for pain, but also respiratory distress. What were you doing when this started? I was marching at band practice. Does anything help you breathe better? So does anything make it worse or better? But in relating to the breathing. Can you describe, you can't really describe it, right? They're just having difficulty breathing, so no pain. It doesn't really move anywhere because you're just having difficulty breathing. And then on a scale of 1 to 10, 1 being no problem breathing at all to 10 not being to breathe at all, can you tell me where you fall on the scale? 9 out of 10. How long ago did this start? 15 minutes. Then you're gonna move on to sample. Are you allergic to anything? No. Do you take any medication? So she takes albuterol, an inhaler. Pertinent past history. She does have a history of asthma. When's the last time that you ate or drank something? 4 hours ago. Again, what were you doing when this started? Marching at band practice. Then your secondary assessment, again, it is going to be more towards the chest. You're going to auscultate the chest and you still hear wheezing. So that should be like bing, 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 like in her medication, in her pertinent past history, and the wheezing, you should already start to get a clue like, okay, this is definitely an asthma attack. Then you get your vital signs, blood pressure, you would explain how you'd get that, pulse, respiratory rate, and then oxygen saturation. Field impression is I believe that this patient is having respiratory issues due to an asthma attack. Then my intervention would be You already give them oxygen. If I need to call medical control to get confirmation for an albuterol, which would be an inhaler, I would go ahead and do that. But if the patient already has them, I would assist them with that. And then I'm going to reassess them after 5 minutes, which would be, patient is still anxious, airway and breathing improve after an inhaler, and there's no audible wheezing, which means that, the patient has improved, but we're still transporting her. So her new vital signs after this reassessment is 118/70, 114, 22, and 97% oxygen saturation on non-rebreather. And then you have your handoff report, which I would say we are en route with a 15-year-old female who presented with respiratory distress. She has a history of asthma and takes albuterol. Her last known vitals were blah, 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 blah. We are 15 minutes away. Do you have any questions or standing orders? Boom, done. Okay. Then this last one of the medical, I'm going to do a diabetic emergency. Actually, I don't like this one. Okay, this one. Just because this one, the patient is unconscious, so all your OPQRST and sample can't get answered. You would write down all of your acronyms, and they tell you are called to a residence for a 23-year-old female with altered mental status. The caller stated that her roommate is not making sense and is eating raw sausage. So right away you think, okay, neuro, what is going on? Who eats raw sausage? Not me. You say, BSI, is the scene safe? Yes. Nature of illness? Altered mental status. How many patients do I have? 1. At this time, I am going to consider ALS, but I'm not going to consider C-spine. General impression of the patient. This is a 23-year-old female not making any sense when speaking and eating raw sausage. Her roommate is there with her. I'm going to determine level of consciousness, saying, hi, my name is Jessica. I am an EMT. Can you tell your name? Where are you? What time is it? What day is it? And do you know why we're here? And they say that she is conscious but confused. Chief complaint would be altered mental status. And then you say, I assessed her airway by asking her questions or having conversation with her to determine level of consciousness. Is her airway patent or obstructed? Can you give me her respiratory rate, quality and rhythm? Does she have adequate ventilations? And then put her on oxygen. Circulation, is she bleeding? No. What is her pulse? They give that to you. And her color or assess skin, which would be pale, cool, and diaphoretic, which is the same thing as clammy. Diaphoretic just means sweaty. This is a high priority patient, and we're gonna go ahead and transport. What were you doing when this altered mental status started? Whether this is the patient or her roommate, regardless, you're still figuring out information. Working outside in the yard for the past 4 or 5 hours. Does anything make the altered mental status better or worse? They don't have pain, mental status doesn't move anywhere, there's no scale. When did this start? 30 minutes ago. So you kind of have to adjust the OPQRST to the situation. You can't always ask those questions. And then any clarifying questions or follow-up questions that you might have, it just says the patient is very hungry, hence the reason for eating raw sausage. Okay, you're going to, ask the roommate, is she allergic to anything? Doesn't know. Does she take any medication, insulin? And that should be your first clue as to, okay, now I know what is going on or what could possibly be going on. Pertinent past history, she is diabetic. Last time she ate or drank something, unknown, but obviously, she's eating sausage, so right then. But sausage, it doesn't really have a lot of sugar in it, and it's mainly protein, so she needs something with sugar now if she's hypoglycemic. What was she doing when this started? Working outside in the yard. And then you're going to do your secondary assessment, which is going to focus on neuro, which would be blood sugar, which is, blood sugar is 37 milligrams per deciliter, which is low. So the patient is indeed hypoglycemic, which is why she is acting so crazy and eating raw sausage. Then you get her vitals, blood pressure, pulse, respiratory, and oxygen saturation. You would ask all of these things. Field impression, I believe that my patient is having a diabetic emergency and that she is hypoglycemic. Interventions, you have to know the contraindications of oral glucose, but clearly she's eating sausage, so she doesn't have any difficulty swallowing, even though she might have altered mental status. Then you would reassess her every 5 minutes. You would recheck her blood glucose after 5 minutes. It says that the patient is starting to talk normal and is able to start answering questions, and then you would give your oral report to the hospital. Trauma assessment. Trauma assessment. Let's see, chest injury, head injury, motor vehicle accident, penetrating abdominal injury, vehicle versus pedestrian, accident. Let's go with chest injury. Okay, so you would write down all of your acronyms this time for a trauma-based scenario. So you would take out the OPQRST, and for the secondary assessment, you would do your 5, 3, 3, 4, 5, 5, 2. And if you haven't yet seen my last video where I go through step by step on how to memorize these acronyms and what they stand for and how to better memorize it, please check out my last video. I think that would really help y'all before you see this one. You would write down all of your acronyms, and then they'd say you are dispatched to the university baseball field for an injured player. Upon arrival, you are escorted to the dugout where a player is sitting up, complaining of chest pain and shortness of breath. He was in the batter's box, and when he was struck in the left side of the chest with a 90-mile-an-hour fastball. Ouch. Okay, you would say, BSI, is the scene safe? Yes. What is the mechanism of injury? Blunt chest trauma. How many patients do I have? 1. And I said at this time, I would consider ALS or additional resources. For this specific trauma scenario, I would not consider C-spine. Then you're going to move on to GLC, so the general impression of this patient. The general impression of this patient is a young man sitting in the dugout in moderate to severe respiratory distress. Then you have your level of consciousness. You would say, hi, my name is Jessica, I'm an EMT, blah, 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 blah. And it says that he is responsive and answers questions appropriately. And then chief complaint is left side chest pain and shortness of breath. And then you would say, I assess the ARA by asking level of consciousness questions. It is open and patent. Can I get the respiratory rate, 24 breaths per minute? Can I get the quality and rhythm? Shallow and diminished lung sounds on the left. Now this should be giving you signs of a pneumothorax. Usually when you hear of diminished lung sounds, it means that there's something wrong with the lungs, especially if they're in respiratory distress. Then you're going to check for adequate ventilations, yes or no, put them on oxygen. At this point, always put them on oxygen. If you're catching on to what's going on, you just always put them on oxygen. Then you're gonna move on to circulation. Any bleeding? No. Now, you might be able to see internal bleeding, aka bruising on the left side, but if you don't see that, that does not mean that there's no internal bleeding. It's just something that you don't see on the patient as of now. Can you tell me the pulse, the skin condition, color, and temperature, which is warm, pink, and diaphoretic? This is a priority patient, high priority patient, and I'm going to go ahead and transport. Okay, move on to sample. Are there any other signs or symptoms I need to be aware of other than the left-sided chest pain? Acute onset of left-sided chest pain and shortness of breath, so no. Are you allergic to anything? Penicillin. Are you on any medication? No. Do you have any pertinent past history? Nada. When's the last time that you ate or drank something 2 hours ago? And what were you doing right before? Doesn't matter. Struck in the left chest with baseball. DCAP BTLS is whatever you check for your secondary assessment for a trauma case. So DCAP BTLS is deformities, contusions, abrasions, penetrations, burns, tenderness, laceration, and swelling, if I remember correctly. But basically you say, I'm checking for DCAP BTLS. Okay, so then you write down your 5, 3, 3, 4, 5, 5, 2, or whatever I said earlier. So 5, head, you're gonna inspect the mouth, the nose, the eyes, the scalp, because, inspect, palpate, and any other facial features. No injuries noted. You're gonna move on to the neck. You're gonna check for the tracheal alignment. If there's any tracheal shift, that should give you even more of like a clue that there is something going on, more like leaning more towards pneumothorax. You're going to check for jugular vein distension, which there is none, and then the cervical spine. Then you're going to move on to the chest, inspect, palpate, and auscultate. It says bruising and tenderness over the left ribs. Breath sounds are diminished on the left side. And then the abdomen, you're going to inspect and palpate in all 4 quadrants. You're going to inspect the stabilization of the hips, and you're going to check genitalia and perineum if it is needed. And then you're going to move on to the lower extremities, the legs. You're going to check for, inspect, palpate, and assess PMS. Same thing for the arms. Inspect, palpate. Inspect just means you're looking at it, like to see if you see any bruises, any cuts. Then you're going to get the vitals, which blood pressure is 95 over 60, pulse is 122, but that's a high pulse. Respirations is high as well, and then Pearl just means pupils are equal and reactive to light. He's already on high flow oxygen, you would reassess his condition every 5 minutes and go ahead and transport. So that is how you would use all of those acronyms for your medical skills day or your oral boards. You really just write all of these down and you ask one question at a time. If anything's ever unclear, like absolutely ask follow-up questions. Or if you're not sure, say, I don't know. It's okay to say, I don't know. That is everything that I have for you guys. Please make sure to like and subscribe. That really helps me out and supports me and my channel. Please let me know if you have any questions, or again, if you use any other acronyms or any other methods of how you study, or if you know of any other website that might have scenarios. But I really hope that this helps y'all as much as it helps me, and I hope that y'all have a wonderful evening, morning, night, whenever you're watching this, and I'll see y'all next time.